Thank you, Chairman Clyburn and Ranking Member Scalise, for getting putting the hearing together today and the interesting panel that we have here. As we go through the process of trying to look at the effects of the COVID on our entire population, and you look at the disparities between those groups that are being more or less impacted than others, and economically the same impacts. Dr. Roy, have you done any studies with regards to vaccinations? I know that there's some governors that believe that, and some mayors that believe we can't get back to work until we get a vaccine. And they believe late fall, early winter we may have a vaccine now, but we can't be shut down till then. I think some of the other members have already discussed the fact that, and in fact, I think in one of the publications just a week or so ago, the number now is 65,000 people per month die from the result of the COVID effect, not from the COVID disease itself, but from the effect of focusing on COVID at the expense of the rest of our society. And so if we don't focus on those folks pretty soon, we've already gone past the COVID deaths with those deaths of people who we have not been paying attention to health-wise. If we continue to do that, it's going to be devastating to our economy. But believing that you have to have a vaccine, to me, is a false sense of security standpoint. There's a recent study that came out that said over 50% of the people, if a vaccine was available, wouldn't take the shot. How do you address that issue? How do you incentivize those people? How do you get past this issue? And then, because of that, it would seem that it's even more imperative that we open up our economy. Would you like to comment on that?
Well, I really appreciate you bringing this point up, because I think it's one of the most reckless policy postures in this crisis to say we're going to wait for a vaccine before we reopen the economy. And the reason why is that there's absolutely no guarantee that we'll have a vaccine in the next 12 to 18 months. We've been working for nearly 40 years on a vaccine for HIV. We still don't have one. We've been working for even longer on a vaccine for hepatitis C. We still don't have one. Now, we have effective drugs that treat active infections for HIV and hepatitis C, but we do not have vaccines. We've never developed a vaccine for a coronavirus before. The land speed record for a novel virus developing a vaccine was the Ebola virus. It took us 5 years to develop a vaccine for the Ebola virus. Now, look, there are very talented people, very brilliant people, lots of entrepreneurs trying to solve this problem. And maybe they'll succeed where others have failed. There are absolutely no guarantees, and we cannot keep the economy locked down until a vaccine that may or may not ever come.
I know you've had a lot of statistics a minute ago with regards to unemployment. The relationship between disease and unemployment is certainly something I've been doing a lot of reading on. I mean, we see increased suicides, alcoholism, drug abuse, deaths from drug overdoses, domestic abuse, all of those things. And it would seem that an active and ongoing economy would certainly take care of a lot of these things. Does your research show that when economies pick up, those things actually slow down?
Yeah, there's a lot of research now, cumulative research about the negative health effects of unemployment and poverty. The one countervailing thing is if you lock down the economy, nobody's getting into a car accident. That's the one thing that goes in the other direction, but everything else is negative. So it's a huge problem, and that's why it's very important. I think there's been this false dichotomy that's been sometimes put out there about, well, if you care about reopening the economy, you only care about money. No. Reopening the economy is essential for public health, because if people are afraid or are told they should be afraid of leaving their homes, they're not going to see their doctors. They're not going to get those mammograms. They're not even going to get treated for a heart attack, and that's really, really important.
It's very interesting. One of my colleagues on the committee, I think last hearing, made the comment with regards to masks, and I pulled that New England Journal of Medicine letter or article up, and I presented it to some health professionals in my district, and they all agreed that wearing a mask outside of a healthcare facility offers very little protection and is actually probably not worth your time or your money to do that. It seems to me that these false things that people are putting out to try and control people seems to be backfiring. And I think people are getting the information out there to show that they can live their lives in a very productive way, in a very normal way. And I think that's the message we should be sending. Thank you very much, Mr. Chairman. I yield back.